Have you ever wondered what it takes to be a high-risk pregnancy doctor? Imagine working under immense pressure, making life or death decisions, and guiding expectant mothers through some of the most intense moments of their lives. It's not just a job, it's a calling. Today I'm diving into the realities of being a perinatologist, the rewards, the challenges, and everything in between. If you love medical deep dives, career insights, and inspiring stories, make sure to hit that like button and subscribe. Today I'm taking a close look at the world of perinatology, also known as maternal-fetal medicine. In a previous episode, Dr. K, a high-risk pregnancy specialist, had shared her experiences, and I'm breaking down the 5 biggest positives and the 5 biggest challenges of this incredible field. One of the most rewarding parts of being a perinatologist is knowing that your work directly saves lives. High-risk pregnancies come with complications, but with the right care, many mothers and babies make it through safely. For Dr. K, few things compare to the joy of seeing a patient reach the end of a difficult pregnancy and hold their baby for the first time. If you love problem solving, perinatology is like being a detective. No 2 cases are ever the same, and every patient presents a unique challenge. Some diagnoses require digging deep beyond textbook knowledge, using both experience and intuition to find the right solution. The more complex the case, the more rewarding it is to figure it out. Many doctors enter medicine for the love of science, but perinatologists often describe their work as something deeper, a true passion. For Dr. K, this is more than just a job. Every day, she wakes up excited to see her patients and help them through one of the most important journeys of their lives. When dealing with high-risk pregnancies, trust is everything. Patients look to their doctors for guidance through some of their most vulnerable moments. By being direct and honest, perinatologists form deep connections with the families they care for. Helping them navigate their fears and uncertainties makes their job even more meaningful. Technology is changing the way doctors care for patients, and perinatology is no exception. With advances in telemedicine, doctors like Dr. K are able to provide expert care remotely, making high-risk pregnancy management more accessible than ever. Innovation is not just about convenience, it's about giving more families the best chance at a healthy outcome. But as rewarding as this career is, it doesn't come without its challenges. For every life saved, there's immense pressure. For every moment of joy, there are difficult conversations and unpredictable situations. Being a perinatologist isn't just about celebrating the wins, it's also about handling the toughest moments with strength and resilience. So let's take a look at the other side of the coin, the biggest challenges of working in maternal-fetal medicine. Being responsible for both a mother and her unborn child is an enormous responsibility. Some days involve celebrating milestones, while others require delivering devastating news. The emotional weight of the job can be overwhelming, especially when complications arise that are out of the doctor's control. There's no such thing as a typical 9-to-5 schedule in perinatology. High-risk pregnancies are unpredictable, and emergencies don't wait for office hours. Whether it's sudden complications or urgent medical decisions, perinatologists must always be ready to act, often sacrificing personal time for their patients. Not every pregnancy has a happy ending. Despite a doctor's best efforts, some cases result in loss, which can be heartbreaking for both the patient and the physician. Perinatologists must learn how to process grief while continuing to support the next patient in need. Medical schools teach doctors how to treat patients, but they rarely teach them how to run a practice. For Dr. K, starting her own telemedicine business meant learning an entirely new skill set, from finances to operations. Many physicians face this struggle when trying to balance medicine with the realities of business. Maternal-fetal medicine is always evolving. New research, treatments, and technologies constantly reshape the field. To provide the best care, perinatologists must commit to lifelong learning, staying ahead of the latest developments in high-risk pregnancy care. Being a perinatologist is not only one of the most rewarding careers in medicine, but also one of the most demanding. It takes skill, resilience, and a deep passion for helping others. But for those who thrive under pressure and love making a difference in people's lives, there's no job quite like it. So what do you think? Could you handle the pressure of being a high-risk pregnancy doctor? Let me know in the comments. If there's a profession that you want me to cover, leave it in the comments and I'll find that person for you. Don't forget to like, share, and subscribe, and I'll see you next time on Time We Discuss.